Good day and welcome to Massage Matters. I'm your host, Chris O'Connor. Massage Matters is designed to give you a hands-on look at the various manual therapies that are available to help you heal your mind, body, and spirit. Massage Matters strives to raise the awareness of these therapies within our community. My hope is that by explaining and demonstrating them, those of you watching will put them to use, encouraging you to become more involved with your health care. Each week features a specific technique, and in some cases we bring an expert guest on board to teach us what we need to know. Some of these therapies you may be familiar with, but I'm sure there are some that will be completely new to you. After we've demonstrated these techniques, you'll be better equipped to decide which treatment is best for you. Today's show will be all about craniosacral therapy. We have in the studio today my special guest, Laurie Knarr, and she's going to go over what craniosacral therapy is, some of the reasons people choose to get craniosacral therapy, and some of the conditions she treats. Later on, we'll be at the table with Laurie and a volunteer to show you what a typical craniosacral treatment might look like. I'm ready, and I hope you are too, so let's get started. Welcome to the show, Laurie.
Thank you.
Pleasure to have you here today.
Great to be here.
So, just give us a little bit of background about yourself from sort of a professional level.
I decided to become a massage therapist pretty much right out of high school. I had some back issues through a part-time job I had and thought it would be a great way to be able to help people, and it was something I could always take with me. So I decided that that was the route I wanted to go instead of, university and all the other fun stuff. So
Right on. So about how many years have you been a professional now?
I've been a professional for just over 16 years now.
16 years, nice.
Yeah, hanging in there pretty good.
Yeah, that's good. Considering our profession is like 3 years, sometimes they say is the burnout rate.
Yeah,
so you're doing
I
really
figured
well.
I'm, antique now.
That's good. Way ahead of the curve. That's good. What got you interested in craniosacral therapy?
A few different things, actually. One of them was I had clients that had previously had craniosacral therapy and as I'm doing massage on them, they would react in a more craniosacral way per se on the table, and I wasn't sure what was going on. And they were telling me, oh, this is what craniosacral has happened, and just hang out where you're sitting, and when I'm done, I'll let you know, and then we can continue on with the massage. And I was very intrigued by this, and
Right.
bodies can do this.
Okay.
This is fantastic. And so I decided from there on, I should probably take the course, and I figure if this is helping the clients, I can better facilitate, hopefully, helping other clients out as well.
All right. So you decided to take craniosacral therapy. What's sort of the background of craniosacral therapy? Sort of a little bit of the philosophy.
A little bit of the philosophy and background is it evolved actually from traditional osteopathy, and Dr. John Upledger has taken traditional osteopathy and kind of put his, I want to say, spin on it, or has done more research and found things that he finds are relevant through the craniosacral system that he can teach to therapists in smaller courses and allowed to bring them through without having to do the full-on scope
Right.
of osteopathy.
Doing osteopathic treatment. So who typically trains in craniosacral stuff? I mean, obviously massage therapists, but are there other professions that are doing
Certainly, I've taken courses with massage therapists, with chiropractors, with athletic therapists, with physiotherapists, even some, I believe we've even had psychologists in classes. So it's been a fantastic variety of people.
Nice. So during the treatment, what are your clients? What are the people on the table typically feeling? Is it something is it a gentle technique?
It's a very, very gentle technique typically, no more than 5 grams of pressure, and it's very light touch. It can be integrated in with massage, in my case, as well as it can be done as a standalone treatment, which is really nice. And they generally feel very relaxed, very comfortable on the table. They may feel things changing very gently, slowly moving and adjusting per se,
Right.
and either where I'm treating them or somewhere else in their body, because cranial basically focuses on the body's fascial system, and by doing that, it's one big piece through the whole body. So even if I'm treating down at a knee or at a hip, they may feel a shoulder or a low back or something also adjusting, because it is one big system through the body.
Right. So unlike a chiropractic adjustment
Yep.
per se, it's a very subtle, sort of more
Very
gentle,
subtle, very
underlying-
gentle, very calm, and very few reasons why you couldn't get it either. There's no big force to it, so just about anybody can receive treatment.
Right. How long does a treatment typically last? If you were doing just a craniosacral, let's say.
Ideally an hour.
Okay.
We can treat in shorter amounts of time, but ideally, in order to fill a full scope of a treatment, an hour would be perfect.
Yeah, you don't want to rush things.
Yes, exactly.
Okay. I was going to ask you today, what type of conditions would you normally see and treat as far as a craniosacral treatment goes?
Basically, I shouldn't say basically. Big one is headaches, migraines and tension headaches, post-concussion syndrome, TMJ issues, sore backs, sore joints, fibromyalgia, chronic pain syndromes. We also treat children. So I've had people referred to me for like lactation consultants have referred to help the baby achieve a better latch while feeding. Yes. Birth trauma, babies are squished and coming out, so we want to help their systems get back to as optimal as possible. And again, it's very gentle, so it can be done on any age.
Right. How long was your training when you did this? Is this something that takes like years? I guess it takes years to get experience.
It takes years to get experience.
The actual course itself is sort of...
Yeah, the first course, each course is set in 4-day modules.
Okay.
And then you can continue on when you're ready to move on to the next course. So I've taken, they run them in a core set of courses. So there's 6 core courses. I've done 3 of them, and I've also done the pediatrics course. And so they're done 4-day modules, and you can take them as close together or as far apart as you wish, as you want to continue on with your education.
So you've told us a little bit about what somebody might experience when they're on the table. When somebody gets up from your treatment table and is going back into their life, what sort of things could they expect to feel either different or something new?
A lot of my clients say that they just generally feel more space, like their body's back to where it started before everything, started compressing and folding in and the fascia started restricting. Typically they'll feel more relaxed, they'll feel like they can move better. When within 48 hours, they may continue to feel things change. So all of a sudden, the shoulder starts to feel even better if we were treating a shoulder, or their knee might start feeling better even if we were treating a shoulder. Right. But typically within 48 hours, they'll feel a big change, a lot of release, very calm, generally sleep better, and that kind of thing.
Right, so somewhere that completely wasn't even part of the treatment plan.
Yeah.
Sometimes can do that. Well, that's
Definitely.
Awesome. Thanks, Laurie. Okay, coming up after the break, we're going to be at the table, and Laurie's going to take us through some of the things that she might do in a treatment. So stay tuned. You don't want to miss it. You're watching Massage Matters on Community Connection, only on Rogers TV. Okay, welcome back. We're here at the table with Laurie, and she's going to take us through what a typical craniosacral assessment and treatment might look like. All right.
Awesome. So what we're doing today is we're going to do a general craniosacral assessment and treatment versus one that I would do within the scope of a massage. So our client or patient is laying happily on the table, hopefully, fully clothed. Okay. Whereas with a massage, obviously, it would be a traditional massage. So what I typically do is start off down at the feet, and what I'm going to do is I'm going to start tuning into the craniosacral rhythm, which is created by the flow of cerebrospinal fluid, which is the fluid that encases the brain and spinal cord. And it can be felt throughout the whole body. And so we're going to tune into that. And by listening or feeling it, we can assess where there might be issues or areas that are stuck or don't move or flow as well throughout the body and the body's connective tissue or fascial system. So what I'm going to do is I start off at the feet, and then we move our way up, listening at different stations through the body, figuring out if the pulse or the craniosacral rhythm is stronger or weaker in certain areas, which again will indicate where we might want to start off our treatment. Now today what I'm going to do is I'm going to do what would be typically a headache treatment, or a treatment that would be located in and around the head and skull, which is generally a huge focus with craniosacral therapy, as our primary area that we're treating is the craniosacral system, which is made up of the brain, the spinal cord, cerebrospinal fluid, as well as the dural matter that is encasing all of it and holding it all in.
So it's really in the body, the dural membrane that you talked about, it has a really good firm bony attachment at
Yes.
a certain bone in the skull, and then again down at the bone called the sacrum. That's sort of where the craniosacral comes about.
Yes. Definitely, yes. Okay. So I'm just assessing the rhythm and feeling where it's not moving as well, the various cranial bones that might not be moving with the rhythm, as they actually can move independently. They are not your skull is not one big bone. It's actually a whole bunch of different bones put together so that it allows for that.
So the fluid as it's moving, it's sort of, could you say it's sort of like the tide, sort of like the ebb and flow of like the ocean, or if you're at a lake and the water's kind of coming in and kind of going back out a little bit?
Definitely, and it's its own system, its own pulse. It's independent of your heartbeat. It's independent of your lungs breathing, and it's its own rhythm.
Yeah, so just as if it just came to me, like if there was like a rock or let's say a shell on the beach and the water was going around that solid object, that's sort of what you're feeling
that's
for,
what we're
where the water
for,
is not. Okay, perfect.
So what I would typically do with headaches is, again, as I'm looking through, or feeling, I shouldn't say looking, feeling,
Yep.
as I'll start off typically by releasing the fascia, or the looking to release the cranial, what we call the occipital cranial base, which is down at the base of the skull where it meets the spine. And the muscles in there typically get very tight, as well as the fascia around them. So what we want to do is we want to look to release that. And so just by gently setting my hands in that area, I will wait for that to soften. My client might be feeling decreased pressure in that area. They might feel heat radiating. They might feel a little chilly. They might feel like they want to take a deep breath. This is all very typical signs and symptoms of fascia releasing in the body.
So right in this area, it's hard to see where Laurie's got her hands, but right in this area is the base of your skull. This is your skull here, so she's lying on her back. This is the back side of her head. And what Laurie's got her hands on is right at this area of the bones. And you can see on my skull here, there's all these different outcrops, and this is all attachment points for muscles at the base of your skull and right at your neck. So she's got her fingers right in through here, and her thumb sort of on the occipital bone here. This is this orange colored bone in here, and she's just holding for a release.
And then once we have a release in there and everything starts to feel better, I'll again start to do a bit of assessment and see what's changed, because that may change different areas of the body, and either head down to shoulders if that's what's causing it. If it's migraine, it's typically more up within the skull. Again, with concussions, this is huge, releasing any of the restrictions that I can find around the brain itself. And then again, I will place my hands there. So if let's say she had a restriction in here, I'm just going to gently set my hand there, hang out, wait for it to release, wait for change. Again, wait for that deep breath, softening of the tissue, more space. And again, as I'm treating, it's not unusual for clients to feel change in other areas of their body, because we are dealing with the fascial system, which is, again, one huge web throughout the whole body. Everything's attached to everything else.
So you might be working on her forehead and she may actually feel like some warmth, let's say.
Yes.
A warm feeling or a tingling in her foot.
Yes.
Which wouldn't be necessarily uncommon. It
Nope.
may be uncommon for the person on the table, but as you as a therapist to hear that, that's kind of
That would be great.
something that's a positive. How much force are you using? Well, you talked about 5 grams. That's like we talked about earlier when we were getting ready about the weight of a nickel.
Weight of a nickel.
An American nickel.
An American nickel.
American nickel. So it's a very, very gentle.
Very gentle. Sometimes a little more pressure is required, but very rarely. And it's always done, again, within the patient's comfort zone. And again, I will demonstrate that sometimes through a treatment, a body or a person will position themselves in an area that's of more comfort to them.
Right.
And that will also help allow the fascia to release.
Really, the whole idea behind it is one of the phrases that I understood was unwinding. It's sort of like we're unwinding things, as opposed to necessarily a stretch. It's more of this, just meeting something and just allowing it to go unwind and go where it needs to go to get space. And again, this all ends up coming back and connecting into the central nervous system of the body. So by removing barriers through the body, it's allowing the brain and spinal cord to communicate with the body in a much more effective way. And therefore, people typically feel better because they produce less effort to get signals from point A to point B. So that's kind of the utmost goal of this, is to
allow the brain and spinal cord to communicate better with all the areas of the body, whether it's organs or muscle or ligaments or whatever it is that needs.
Yeah, for those watching, that's all of the nerves that, all the nervous feedback goes directly into the spine before it goes up into the higher brain center. So having that roadway cleared is always beneficial.
So again, if I were to find something through the shoulder, same thing, hand above, below, look into the area. And while I'm doing this, I'm also continuously thinking about what that craniosacral rhythm is doing as well. As I feel it change, you'll feel it soften and become more consistent throughout the body, then we know that a good change has happened and the body's able to communicate better as well. So
this is, and again, this isn't something typically the person you're treating might say something like they feel warmth in their foot or they feel their hip moving, but they may not be able to sort of articulate in words exactly what you're feeling.
Exactly.
Okay.
I've had clients where I'm like, wow, this feels really amazing at your shoulder, and they're like, oh, I don't feel anything at my shoulder, but my knee is really cranking out some heat now. So sometimes what I feel and what they feel are two different things, but the end result is reduced headaches, reduced knee pain, reduced whatever it is that our intention of that treatment is.
Because as odd as it kind of sounds sometimes, the knee actually can be the one that's the problem that's really contributing to the headaches.
Yes.
You know,
the one saying I was taught is the area of disease is not always the area of dis-ease. So what's causing it isn't always where the pain is felt.
Right. It's more, like you said, it's a dis-ease as opposed to what we think of like a pathogen, a flu or something like that. It's just an area. Sometimes pain can kind of be a bit of a liar. It tells a bit of a fib. It's not that the person's not experiencing the pain, but that they actually...
It's where it is isn't always, the true cause.
Okay, that's fantastic. So, I want to thank Laurie and Darcy for coming in today. That was really awesome for them to do that. And coming up after the break, I'm going to be taking you through a stretch for your lower spine. And you don't want to miss it. So please stay tuned to Massage Matters on Community Connection, only on Rogers TV. One area that's always under pressure is our low back. I want to show you a simple movement that can really help relieve pain and pressure in your low back. The pose I'm going to show you sometimes has different names, but the idea is just to relax and let your muscles unwind. Don't get caught up with the name of the pose in this case. So what you're going to do is you're going to start by just sitting on your knees. You can do this on the floor. We're doing on the bed here so that you can have a better idea. But you can do this just nice and gently on the floor, all right? And what I'm going to get Darcy to do is just gently roll forward with her hands out in front of her so she doesn't fall. And just put her forehead down. I mean, it looks like a very simple stretch, but if your back is tight, trust me, it's going to help stretch things out. All throughout this area, you're going to start to feel a pull. All you want to do is just take some nice deep breaths and just relax. Always remember when you're doing any kind of stretching that you want to go just until you feel a pull. All right? Sometimes you might not go very far before you feel a pull, and that's okay. I just want you to hold it there until you don't feel a pull anymore, and then take it a bit further. As you advance through the pose, what you can do is stretch your hands out in front of you, and this is going to give you more of a stretch. I know I said it was for the low back, but we're going to be able to go from the low back all the way out to the front here and down the arms. Again, just holding and breathing. You could do this for 30 or 45 seconds. That seems to be a nice general rule. You could hold it for a minute if you want to, and you want to do this 2 or 3 times. Another thing you can do to help stretch out is bring your hands back towards the back. In yoga, this is sometimes called child's pose. Your palms are towards the ceiling. Okay? As long as you feel comfortable. If you start to feel like you're getting a headache or things are starting to get sore, make sure that you stop. All right. Always remember that if you're experiencing any pain, stop immediately. You should feel a stretch and not pain, and always consult with a healthcare professional before you attempt to make a dramatic shift in your activity level. And always take it easy when you start a stretching routine. Today I'm going to introduce you to a book that will really help you stretch your mind. I'd like to share the beginning, the introduction if I can with you. It's called A True Story. I'm sitting in a quiet room at the Millcroft Inn, a peaceful little place hidden back among the pine trees about an hour out of Toronto. It's just past noon, late July, and I'm listening to the desperate sounds of a life or death struggle going on a few feet away. There's a small fly burning out the last of its short life's energies in a futile attempt to fly through the glass of the window pane. The whining wings tell the poignant story of the fly's strategy. Try harder. But it's not working. The frenzied effort offers no hope for survival. Ironically, the struggle is part of the trap. It is impossible for the fly to try hard enough to succeed at breaking through the glass. Nevertheless, this little insect has staked its life on reaching its goal through raw effort and determination. The fly is doomed. It will die there on the windowsill. Across the room, 10 steps away, the door is open. 10 seconds of flying time, and this small creature could reach the outside world it seeks. With only a fraction of the effort now being wasted, it could be free of this self-imposed trap. The breakthrough possibility is there. It could be so easy. Why doesn't the fly try another approach, something dramatically different? How did it get so locked in on the idea that this particular route and determined effort offer the most promise for success? What logic is there in continuing until death to seek a breakthrough with more of the same? No doubt this approach makes sense to the fly. Regrettably, it's an idea that will kill. Trying harder isn't necessarily the solution to achieving more. It may not offer any real promise for getting what you want out of life. Sometimes, in fact, it's a big part of the problem. If you stake your hopes for a breakthrough on trying harder than ever, you may kill your chances for success. This book is called CEU-CENTRAL. It's written by Bryce Pritchett. Let's show you there. Dr. Pritchett holds a PhD in psychology and is recognized worldwide as an expert on personal and organizational change. He has over 20 million copies of his book in print. As you might be able to see, this is my copy, and it's a little worn on the cover, and that's because I've read it and reread it many, many times. It's only 39 pages long, but it's packed full of valuable information on how to make big improvements in life with less effort. Many of us have been taught that we have to work very hard to get where we want to go in life. Well, sooner or later we find that we reach a point where we can't try any harder. Dr. Pritchett states in his book, this is not an argument against self-discipline or persistence. Those are true virtues. Over a lifetime, they can make a powerful contribution to success and achievement. What he's getting you to think about as you read is how to see things in a new light. We've heard the phrase thinking outside the box, and this is exactly what this little book shows you how to do. You might not be able to find this book in your local library, but it only costs about $8, and it's a real bargain for what the book has to offer. Do yourself a favor and get a copy of this book. It's a truly great way to massage your mind, and it may just help transform your life. Well, that's all there is for today's show. I want to thank my guest today, Laurie Knarr, and our guest demo, Darcy. It was wonderful to have them here. If you'd like to find out more about Laurie and the services she has to offer, you can contact her at belmontnaturalhealth.com. I want to thank all the volunteers here at Rogers who have made the show possible. I want to thank you for watching. I hope you learned something new, and I also hope you'll take the time to give us some feedback about today's show by emailing your comments to massagematters@rogers.com. If you'd like to find out more about craniosacral therapy, you can go to the Upledger Institute at www.upledger.com. Please join me for our next episode of Massage Matters, which will feature my special guest, Knarr, who will introduce us to shiatsu therapy. I'm looking forward to it, and I hope you are too. You've been watching Massage Matters on Community Connection, only on Rogers TV. We'll see you next time.